It's the appointed time. We have a quorum. I call to order meeting of the Bills Committee on Supplementary Medical Professions Amendment Bill 2025. This is the second meeting of the Bills Committee. The agenda item is meeting with deputations and the administration. Let's first invite representatives of the administration to come inside the conference room. In accordance with previous discussion, this is a public hearing. We have invited deputations to attend this hearing to express their views on the bill. I will first ask the deputations express their views, and then the administration will be asked to give a consolidated response. For the remainder of the session, we will have a Q&A session allowing members to ask questions and the administration to respond. The administration is to provide a written response to the submissions of deputations and the verbal views they express at the meeting. Welcome, deputations. Please note the following. Each would have 2 minutes to speak. At the 2-minute mark, the timer will make a sound. Please stop speaking. Please be succinct. Please do not refer to the views expressed by other deputations. Please speak either Chinese or English. Let me also remind you that your speeches or submissions neither will be protected by the Legislative Council Powers and Privileges Ordinance. Welcome, representatives of the administration, Ms. Elaine Mack, Deputy Secretary for Health 3, Dr. Pang Fei-Chao, Commissioner for Primary Health Care, Mr. Derek Lee, Principal Assistant Secretary for Health 3, Dr. Vincent Chung, Commissioner for Chinese Medicine Development, Mr. Emmanuel Lam, Assistant Secretary for Health 3A, Dr. Ann Chi, Principal Medical and Health Officer, Service and Manpower Planning, Department of Health. There's more. Mr. Daedru Secretary, Supplementary Medical Professions Council of the Department of Health, Ms. Priscilla Poon Yi Hong of the Hospital Authority, Chief Manager, Allied Health. All right, it is now time for deputations to speak. I will first invite Professor William Tang from the Hong Kong Metropolitan University Department of Physiotherapy. 2 minutes. Thank you, Chair. In the 2023 policy address, the Chief Executive announced for the high-quality development of the healthcare education in Hong Kong. Some goals have been set. We are to be developed into a hub to nurture healthcare talents. As a professor in physiotherapy, I think we have solid foundations to become a medical education hub. We have met various international standards and we have been recognized. But physiotherapists currently face restrictions in terms of referrals. It has hurt us as a leader in healthcare education. With the reforms in the bill, providing direct access to the services of physiotherapists, it will help consolidate our status as a hub for medical education. It will also help cluster talents. That's it for me. Thank you. Mr. Alexander Wu from the Hong Kong Physiotherapy Association. Thank you. Good afternoon, all. On behalf of the association, I would like to thank the administration, the government for promulgating this bill. But the bill does not meet public expectations exactly. We need to provide more convenience to citizens. Right now, the bill allows for, in accordance with clinical protocols, physiotherapists may provide services directly to citizens, but this is very rigid. We should instead use the word guidelines. This will allow for more room for physiotherapists to make judgments. Right now, it also poses restrictions to physiotherapists to only provide treatment for certain parts. It goes against the vision of primary health care, it is also not conducive to patient safety. It has also hurt physiotherapists' ability to treat various illnesses. I urge the government to expand the scope of physiotherapy services in order to enhance the mechanism. We need to have more screening mechanism and allow for more room for physiotherapists to provide treatments. In Australia, the Physiotherapy Association has 30,000 members. They also support the bill in Hong Kong. In Australia, once they have undergone similar reforms, citizens were able to save significant costs. And there are also a number of citizens taking advantage of the direct access model. Your time is up. Thank you. Professor Zhang Chi-chung from the PolyU Department of Rehabilitation Sciences. Thank you. PolyU has 46 years of experience training relevant professionals. And many of the students, upon obtaining accreditation, do not need to have other referrals made to provide services in many other places. Hong Kong seems to be behind, even not matching the models in Indonesia. I am just saying that right now people say if physiotherapists cannot provide services directly, is just an invalid concern. It has been shown in different parts of the world. Physiotherapists are able to provide services appropriately, and we see physiotherapists being able to provide benefits. They may also be able to identify risks for cancer. Even they can make referrals to registered medical practitioners. As seen in different parts of the world, in physiotherapists' treatment, there is no need for diagnoses made by registered medical practitioners because physiotherapists can exercise professional judgment. I would say this: if there is no medically valid concern, it is just bias. So I urge the government to allow for direct access to services of physiotherapists to provide greater flexibility to the public. Thank you. Thank you. Professor Aaron Leung from the St. Francis University SKE School of Health Sciences. Thank you. I speak on behalf of the School of SFU. I graduated in 1973 in Hong Kong, and then I went to Australia for further studies. In my many years of practice, I have seen physiotherapy develop from the 70s, when all referrals have to be made by registered medical practitioners and all judgments would have to be accepted as is. After many years, we have seen physiotherapy programs being offered on a bachelor's level. We have also seen developments in international practices. We have referred to these different developments and set up a professional curriculum. In Australia, they already allowed for direct access of services to physiotherapists, and they would accept practitioners from the UK, Ireland, and most importantly, Hong Kong, that would allow for them to provide services without referrals. Ironically, Hong Kong does not allow for direct access to physiotherapist services. Physiotherapists in Hong Kong undergo rigid training. They can identify red flags. They also can identify yellow flags that require continuous monitoring. They also know when to make referrals to other medical professionals. The concern that this is going to hurt patients has no medical basis. Your time is up. Professor Grace Cito from the Tsinghua College, Acting Dean of School of Medical and Health Sciences and Physiotherapy Program Leader. Like other experts, I support this bill and I support the direct access to services of physiotherapists. Physiotherapists can provide appropriate services. If we allow for this, it will allay the burden on the public health care system. It also shortens the waiting time for patients. It is beneficial to the public. But the proposals in the bill have many different limitations. One pathway would require diagnoses from other medical practitioners within the past 12 months. It can cause confusion to the public as to when they can seek treatment from physiotherapists. And there are many social welfare organizations that are already providing appropriate services in physiotherapy and other disciplines. The bill's provisions will pose some restrictions. As the acting dean of the School of Medical and Health Sciences, I would like to express some views. We are now at our 10th year of nurturing relevant talents. We have medical laboratory technologists that are top-notch, working in advanced laboratories and institutions. We have also seen developments in the relevant technology. We are embracing the technology, but recently we have seen medical laboratory technologists board without consultation to lower the practicum hours from 400 hours to 200 hours. Your time is up. Thank you, Professor. Mr. Oh Yeung Kim from the Hong Kong Physiotherapists Union. Physiotherapy would make great contributions to the health care. To ensure people would have a good physique, they would be in good physical condition, and then they would have good health. Finally, we see this bill introduced. We see the bill's provisions being somewhat different to the practices elsewhere, but I think a small step is better than nothing. I also have some suggestions. We have seen clinical protocols having to be strictly followed under the bill's provisions. We suggest replacing the term with clinical guidelines to offer more flexibility. Also, in terms of clinical judgment, we shouldn't adopt the unit of POTS. It will pose some restrictions. Physiotherapists are apt in treating musculoskeletal conditions. We should adopt this approach instead, making reference to musculoskeletal structure. We have seen physiotherapists being able to make referrals to medical practitioners if necessary. They can make the judgment. I think we should allow for that because their physiotherapists are not at a lower level than medical practitioners. We also want to make sure in the end we want to have direct access to physiotherapy services. I hope that with the bill we will no longer have restrictions on physiotherapy because it will only be detrimental to the public health. All right, thank you, Mr. So King Ken from the Hip Hong Society.
Thank you, Chairman. Hip Hong Society has been providing services to the public. We do have guidelines regarding physiotherapy. We do have a monitoring system. In relation to the amendment, I'd like to state our position. Now, for non-referrals, there are 3 conditions. There will be clinical protocols to be formulated, and for pediatric physiotherapy, it would be targeting at the autistic and stunted development children, and we should not be focusing on individual parts of the anatomy. We should cover the entire body. Second, the diagnosis, there must be diagnosis from within last 12 months. And normally people will have to wait for 2 months. I think we have to shorten the queue. Now, for the residential care services at the primary level, we are providing screening and support for the cases, and this will not be affected by the amendments to the bill. Third, it is also proposed that in the community, the community services should also be excluded from the bill. I hope that these amendments will not adversely affect the existing services. Mr. Ng Tat Ming, Hong Kong Association of Radiographers. Chairman, members, regarding the limited registration under the Supplementary Medical Profession Amendment Bill, we'd like to say this. There are 200 or so shortage of radiographers, and I think we have to make sure that the standards will be commensurate with local standards. And we do have contact with the international organizations. We do compare notes, and we do have a lot of experience there. Second, there should be a sunset clause and a dynamic adjustment mechanism. In 2026, the number of trainees will be increased to 180 and 230. In 2030, there may be a saturation of manpower. There should be a sunset clause. If we manage to achieve the target of at 90%, then we should activate the sunset clause. And there should be a dynamic adjustment. We should avoid the situation where previously there was an oversupply of trainees. And we have to give priority to local graduates. And we cannot really allow the local recruitment to be superseded. We appreciate the intent of the bill, but there has to be a sunset clause. There should be participation of this sector. I hope the members will take on board these recommendations. Thank you. Next, Tonghua College, Bachelor of Science in Medical Imaging and Radiation Therapy. Dr. Wong. Chairman, members, I am Vice Professor of the Tonghua College. I'm also representing Professor Lai in making my statements. Regarding the limited registration, I would like to state our position. First, there should be a screening mechanism for the non-locally trained professionals. If we have sufficient manpower, we should stop the importation of the radiographers. Second, we should give priority to local trainees. The hospital authority, which is the largest employer, should give priority to locally trained professionals and minimize the wastage of the resources devoted to training. I hope that members will take this into account. Hong Kong College of Radiographers and Radiation Therapists. Chairman, in relation to the Supplementary Medical Professions Amendment Bill, I'd like to make 3 points here for members' consideration. First, we should adopt in Chinese the radiographers as the term, and we should be on the same par as optometrists and physiotherapists. The government has adopted radiographer as the term in Chinese, like in the hospital authority. For details, members might wish to refer to the paper earlier sent to members. MRI should be included into the scope of expertise. MRI involves some strong magnetic waves, and it should be operated by well-trained radiographers. In the public hospitals, this is really the case. Now we have the International Association, the WHO, recognizing this. Ultrasound examination and MRI should be included in the bill. Third, we propose that we should be listed as the nomination organization for preliminary investigation team members. Our college has been recognized by the authority. It is sufficient representative. With our involvement, we should be able to increase the credibility of the process. I hope the members will support these recommendations. Thank you. Hong Kong Association of Medical Laboratory Technologists, Ms. C. Chairman, I'm sure the members would agree that the SMP team plays a very important role in the healthcare system, and the training would certainly make a difference to the level of service and the safety of the patients. In this amendment bill, the CPD would be made a mandatory requirement for renewal of qualifications in order to enhance the quality of service. I'd like to let members know that the MLT board, without consultation, slash the clinical training time by half, and this is running counter to the original purposes. The pre-service training is the core part of the whole training process, and theory and practices cannot be separated. In Europe, they have 500 to 1,000 hours of internship. In Hong Kong, it will be slashed from 400 to 200. It would affect the examination, lab examination result, undermining the safety of the patients. There are suggestions that MLTs would be brought in from outside. If you slash the training hours, it would certainly affect the competitiveness of this profession. The MLT Association has already issued a statement in the Beng Pao Daily and SCMP objecting to this proposal. And I hope that the authorities would have regard to the training hours to make sure that we will be able to up to scratch when we train up the graduates. Hong Kong Polytechnic University Department of Medical Technology and Informatics, Mr. Wong. Well, I'm sure we heard what Ms. C has to say. I've been a registered MLT. I just retired from the Hospital Authority. I am a professor at the Polytechnic University. From experience, I can vouch for the fact that pre-service training would be very important, and this is a very important area that we have to safeguard. We're dealing with human lives. In our examination, before and after the test, there are so many hurdles. There are so many areas that we cannot lose sight of that would be vulnerable to errors. It would take internship and pre-service training that we would be able to guard against all these eventualities. if we do not do a good job of pre-service training by slashing the hours, it would impose a heavy burden on the frontline staff. And I'm sure the people on the front line are working exceedingly hard right now, and lab tests are getting increasingly complex, and technologies are improving by leaps and bounds. And if we have 200 hours of training, this is really running counter to international practices. Not only would this impose a burden on the front line, it would also undermine the professional competence. The patients are also running significant risks, and erroneous reports may not be picked up easily. And this is also undermining the cross-disciplinary collaboration and recognition. Thank you. Hong Kong Society of Professional Optometrists, Professor Chen. Thank you very much. The optometrists have been urging for a bigger role in the primary health care. Now, this amendment is intended to rationalize the current situation. It is a simple and non-controversial recommendation, but it has attracted the objection from the ophthalmologists. I think it is a reflection of how difficult it is for the optometrists. Now, for the ophthalmologists, there is no primary care, and the world over, optometrists are given a very significant role. They have good interaction with the ophthalmologists. We've been waiting for this primary health care reform for so many years. As a citizen, I agree that Hong Kong specialists are of world-class standards, and the allied professionals are also of world-class standards. Now we have the ophthalmologists represented here, and I hope that there will be good exchange of views here. Now, we have added Part 5 and Part 6 to this amendment. There are 4 parts to the optometrists. It would be very easy to confuse. The optometrists working in the public sector take up a very small proportion compared with the overall scheme of things. We don't have our own department, unlike PT and radiographers. Is it right to add Part 5 and Part 6? Many graduates are really concerned about their prospect. Hong Kong Association of Private Practice Optometrists, Professor Wu. On behalf of Professor Key, I'd like to make this statement. We are providing 5-year undergraduate programs, and one has to undergo training at the Liking Sik Sik Yuen clinic, and in 2008 the government came up with definition for optometrists. The poly-use cover the pharmacology and ocular health. We are able to get the licenses from Australia, and I hope that the optometrists would enjoy the same status as elsewhere. And let me quote Professor Sketter: optometry is what optometrists do. And also airline health professions. SMPC has already endorsed that. We have the Health Professional Council. I don't think this Allied Health Profession Council is the right translation. optometrist is primary health profession. It's not airline health profession. I don't think it should be put under the airline health profession. It should be General Health Professional Council.
會長葉
All right, next to speak, Ms. Queenie Yip from the Hong Kong Association of Private Practice Optometrists. Members of my association have been actively taking part in the work of the government, such as for the chronic care program. We have been providing screening services. We have been a part of the network to provide primary healthcare optometry services. Members have some concerns. Right now, the definition of optometrists can only provide prescription glasses, but optometrists can also provide diagnoses for diabetes. For example, the government does not send the right message nor gives adequate recognition to optometrists. In order to ensure citizens can rest assured when obtaining optometry services instead of being referred unnecessarily to ophthalmologists, and to provide adequate recognition to optometrists, I urge the government to revise the definition of optometrists instead of relying on the 1985 definition to provide a correct job description for optometrists and their role in primary health care so that it will save the public's time and money in obtaining relevant services. I urge the government to note and review my suggestions and make amendments if necessary in the bill to give adequate recognition to optometrists and to have a more efficient allocation of public resources. Thank you. Thank you, Dr. Li Ting of the Hong Kong Academy of Orthokeratology. I graduated in the U.S., but just like any of my counterparts who have graduated Hong Kong, I want to provide primary health care services to the public of Hong Kong. Right now, citizens have to wait for over a year to get the relevant services. We have many optometrists providing primary health care, eye care in other places, but the codes of practice in Hong Kong were not revised for 40 years. They are seriously behind. We have been taught to provide various services, but we can only right now in Hong Kong provide prescriptions for glasses. In many different places such as the US, Canada, the optometrists can prescribe drugs. Even in mainland China, optometrists can provide education, and it has helped lower the population needing glasses in mainland China. In Hong Kong, optometrists cannot even provide professional education by law. It has impeded the development of optometrists in Hong Kong. It also hurts the public. Our request is simple. Follow the WHO guidelines, revise the definition of optometrists to align with international standards, and provide better primary health care services to the public of Hong Kong. Thank you. Mr. Joe Wong of the Hong Kong Optometric Association. Thank you. I welcome the Supplementary Medical Professions Amendment Bill 2025. I also welcome the renaming of the Supplementary Medical Professionals Council to Allied Health Professionals Council to recognize the status of allied health professionals. There is also a requirement of mandatory CPD among optometrists for many years, so we also welcome the relevant provisions in the bill. With this requirement, there is general consensus and support from the optometrists profession. We believe it will be conducive to continuous development of optometrists. We have also seen with the bill's provisions, I think there is a lack in definition and content on optometric services. I also urge the definition of optometrists to be revised to reflect the latest situation, because in the end that will benefit the public. This is the stance of the Hong Kong Optometric Association. All right, thank you, Dr. Lam Puyan from the Hong Kong Registered Chinese Medicine Practitioners Association. Thank you. We note that in the bill that in future, various allied health professionals would be able to accept referrals from the Chinese medicine practitioners. We note that this is reasonable. All along, we have seen Chinese medical practitioners making referrals if necessary, so we have not seen any incidents either. Chinese medicine practitioners can exercise professional judgment. They can also help identify risks among patients and make referrals if necessary. Unfortunately, right now, 95% of the CMPs are serving in the private sector, but the bill's provisions and application will be limited to CMPs in the Chinese medicine hospital. We think this undesirable. I urge the government to provide a timeline as to when this arrangement will be expanded to the private sector to further the development of the CM sector in Hong Kong. Thank you. Thank you. Professor Wong Kit from the Xinhua Herbalists and Herb Dealers Promotion Society. Thank you. I have some questions on behalf of the society. CMPs have to comply with Chapter 549, the Chinese Medicine Ordinance. However, the bill limits the application of referral arrangements only to CMPs in the Chinese Medicine Hospital. Is there any legal basis for this? Is there any discrimination of Chinese medicine practitioners? And who will bear the risks if private sector CMPs cannot practice? And there is a distinction between private and public sector Chinese medical practitioners. As a veteran practitioner, I'm very concerned. I want to ask, since in the Chinese medicine hospital, it is said that registered medical practitioner would have the power to make referrals, yet the Chinese medicine practitioners from the Chinese hospital cannot make the relevant arrangements. That's it from me. Thank you. Professor Feng Jiu of the WFCMS Hong Kong Council Members Association. We have all along had Chinese medicine practitioners providing referrals because there was no formal restriction of CMPs making referrals. However, we welcome various allied health professionals accepting referrals from CMPs. But as some of my peers said, the application would be limited to the Chinese medicine hospital and it would only allow for X-ray treatments. I urge for more services to be applicable, such as CT and MRI services. I have seen the government's response is that there will be some more concrete measures a year later. I urge the government to promulgate the relevant timeline and plans as soon as possible, and to formulate plans for referrals for the Chinese medicine sector to be prepared. Thank you. Thank you. Dr. Chan CR from the CUHK School of Chinese Medicine. Thank you. On behalf of the school, I would like to express my support for the bill to have various allied health professionals accept referrals from CMPs. In the CUHK Chinese Medicine curriculum, we provide content on diagnostics, and students will, on top of receiving such education in their practicum hours, accumulate the relevant experience. So our students are more than capable of exercising professional judgment to make referrals if necessary. Thank you. That's it from me. Ms. Zhang Xiyong from the Hong Kong Federation of China of Traditional Chinese Medicine. I would like to say there is urgency for referrals of CMPs to be accepted widely. I have been practicing in Hong Kong for 20 years. Before that, I was practicing in the mainland. I have practiced in 2 different places. That made me see how different Chinese medicine is treated in Hong Kong. We need to ensure patient safety, and in fact, allowing allied health, allowing CMPs to make referrals, and that will actually help patients because patients can receive prompt treatment. Not only registered medical practitioners can do that. We have seen before in multiple cases, prompt treatments need to be provided, such as for diabetes and whatnot. These illnesses may be Western, but Chinese medicine would help. And we cannot make referrals. Unfortunately, our patients would have to go back to Western medical practitioners before they can be referred to the appropriate services. Chinese medicine has its own benefits, but is limited because there are limited studies on Chinese medicine. We can, through collaborating with different allied health professions, be able to accumulate more data and in turn further the development of the Chinese medicine sector. Thank you. Thank you, Mr. Ho Guokwei from the Association of Hong Kong and Kowloon Practitioners of Chinese Medicine. Thank you. The association has over 70 years of history. All along, our CMPs have been providing diagnostic treatments. There has not been a single incident. It shows that CMPs have the professional capabilities and are responsible. They would need diagnostics. CMPs would need diagnostics to provide better services, and that is also beneficial to patients. All right, Mr. Chen Hong Chung from the Kowloon Chinese Herbalists Association. Thank you. We have worked with the PolyU Chinese Medicine Alumni Association and another association. We have written to the Health Bureau before to express our views. We have done some surveys. Over 80% of the CMPs who responded to our surveys, they had cross-disciplinary experience, and they had a 95% accuracy rate. There has not been a single healthcare incident. There has not been any complaints either. Allowing CMPs to make referrals to X-ray, CT treatments and services will help provide better treatment to patients. If we pose limitations in the right of referral, it sends the wrong message that only CMPs in the Chinese medicine hospital are recognized and that they have a higher status than private sector CMPs. It will hurt citizens' confidence in private sector CMPs. This is the demand of all CMPs. Thank you.
Mr. Young from the Hong Kong TCM Orthopedics Traumatic Association. Chairman. On behalf of our association, I'd like to say something about the referral rights. Our association, back 20 years ago, has been reflecting our views to the administration to grant us the referral rights. Our association also 20 years ago started liaising with the Jinan University in Guangzhou and various other universities. And in recent years, we have been organizing various workshops together with the mainland universities about Chinese medicine. We've also got in touch with the administration stating our views. Our association and the mainland university have jointly organized courses which have been held up as a model. After 20 odd years of hard work, we are likely to get the rights that we should have been given a long time ago. We have been working tremendously hard for this. The orthopedic patients do need to have the diagnostic imaging services so that the patients would get the treatment that would be recognized by both the TCM and the Western medicine. And I hope that this referral right should be given to the CMPs as soon as possible. This is something that we have been aspiring for over the years. National Federation of TCM Organization, Mr. Low. Chairman and members, we have been around for 50 years. We are uniting various organizations to promote TCM and take these to the modern world. We have been undergoing a lot of training, and we have been fighting for our rights. X-ray referral is something that we have been lobbying for. It is only in recent years that the government is starting the legislative amendment. It's better late than never. This amendment to MPO has to do with the expectations and confidence on the part of the public regarding traditional Chinese medicine. TCM is the way forward. The modern-day diagnostic technologies are benefiting the humankind, but because of the limitation of the legislation, CMPs cannot really use them. CT and MRI are denied to us, and this is really a waste of the technology. The referral is intended to help with clinical diagnosis and treatment, in particular for cases that are risky. We have to make sure that the patients will be safe. I hope that the amendments will be implemented as soon as possible without any delay. If we really want to achieve a satisfactory result, this is something that we have to support, and this will benefit the general public. Thank you. University of Hong Kong Bachelor of Chinese Medicine Full-Time Alumni Association. Chairman, there are some arguments that the CMPs may have made reservations about the CMPs making referral for diagnostic tests. Now, the trainees will have to undergo very stringent training, and they have the theory training and also practical trainings, and the students are given sufficient knowledge about diagnostic training, so they do have the right condition to make referral. So with the referral for diagnostic tests, all CMPs will be allowed to do so, and I hope that there will be publicity. And there are three types of people who should be informed. First, the members of the public. I think we have to let the public know about the government's determination to develop traditional Chinese medicine, inspire confidence that. Second, the other allied health professionals, they should be given the confidence to work with the CMPs in order to foster better cooperation. Third, the insurance sector. Now, with the diagnostic tests, we should really let the insurance sector know about the legislative amendments so that the insurance products would be meeting with the public expectation. Hong Kong Alumni Association of Guangzhou University of TCM, Mr. Wan. Chairman, members, fellow deputations, we support the idea of using allied health professions to replace supplementary medical professions, because these would enhance the professional status of the professions. Second, we also support the referral by the CMPs to the MRTs and radiographers, because these would be benefiting everybody all around. The amendments are also in line with the national policy. These amendments will also facilitate the CMPs to practice in the GBA. Good communication would enable the CMPs to be integrated into the mainland setting. There is a lack of communication among the professions. With the amendments to these ordinances, I hope that different disciplines will have more exchanges, like PTOT, RGE, and MLTs. They will understand each other's work much better and take full advantage of these referral rights to give full play to the potential. With the amendments, I hope that there will be training on the diagnostic imaging, and not only should this be part of the undergraduate training, there should also be training for the practitioners, so that there would be more training regarding diagnostic testing. Monsieur, HACPM Association, I support the amendments to this ordinance to allow the CMPs to make referrals for diagnostic tests. This is in line with clinical needs and also protect the safety of the patients. Chinese medicine is about identification of illnesses the modern day diagnostic testing technologies would supplement the TCM practices, because they will enable them to identify the issues. The TCMs never object to the evolving technology. If Walter lives today, I don't think he would be insisting on taking a pulse with 3 fingers. I'm sure that he would be using technology to help with his practice. TCM should embrace technology, and this is an embodiment of modernization. We urge the government to open up the referrals so that the traditional Chinese practitioners will be able to collaborate with the airline health professions, and we should have people-based system. Ms. Wong, Chairman, members, on behalf of my association, I am in support of the amendments to the SMPO and allow the MLTs and LG to take referral from the CMPs. We're composed of the TCMs in Hong Kong, and one of the important functions is to learn modern technology, modern diagnostic technologies as part of our practice. We are talking about integration between Western and Chinese and medicine, and this is important. We feel that the Chinese medicine practitioners do have their expertise to make referrals. They're up to the job. I worked in the mainland for about 20 years, and I've taught a lot of Hong Kong students. The fact is, in the mainland, the CMPs are able to make referrals, and this will start with the junior practitioners. And I hope that the government would promote the development of traditional Chinese medicine. Ms. Fong, we have a number of recommendations here. With the collaboration between different professions, the patients can seek OT and PT services without referral, or they can also get direct access to the OT and TP if they have the diagnosis within the last 12 months. In the code, it has already stipulated that in emergency situation and other circumstances, the OT and PT can provide the service. There have never been any complaints about misconduct because of this over the years, and I don't think there is any need to change this. If we can provide timely and appropriate services to the public, it would certainly save us a lot of resources. These OTs who have been working so hard for so many years should be allowed to continue with their services like before. There is probably a lack of understanding of the OTs, and I hope that in the CPD we should cover the rehabilitative medicine, and maybe in 6 to 12 months' time, the government should organize more seminars and workshops so that all the airline health professionals can collaborate with one another to facilitate better cooperation going forward. Our association is happy to be part of this, and hope that there would be more clinical protocols to be formulated. Finally, there is this limited registration pathway. Non-locally trained, qualified professionals that would be employed. Thank you.
Thank you. Professor Philip Lee from the Hong Kong Academy of Medicine. Thank you. The HKAM along supports cross-disciplinary collaboration and to consolidate the status of allied health professionals. We support the renaming of supplementary medical professions into allied health professions as a result. We also support under specified circumstances people can seek services directly from physiotherapists and occupational therapists. When patients are receiving PT and OT services, it would be more convenient, but it does not mean we would not need any diagnoses. And we think only with medical practitioners providing diagnoses, one may be aware of the potential developments of the illnesses and conditions. I would also say this. It said specifically in the presentation of the Health Bureau, it said the allowing of Chinese medicine practitioners to make referrals is not a way to replace registered medical practitioners. We welcome its application only in the Chinese medicine hospital to pilot the application. We also urge the administration to keep to this to ensure patient safety. Thank you. Dr. Emily Yeung from the College of Ophthalmologists of Hong Kong. As a statutory body, we have all along been safeguarding the eye health of Hong Kong. We also act as a gatekeeper for the profession. In order to safeguard patient safety, amendments should be extensively consulted. We do not support optometrists' suggestions because we have not had extensive consultations. For the screening services, it is essentially diagnostics because one has to determine whether the patient has the condition or not. It would require adequate training and assessments as well as an oversight body and clinical training in order for one to be certified to provide such services. There should also be liability and accountability mechanism in place. If one has more serious illnesses such as neurological and thyroid illnesses or even multiple sclerosis, ophthalmologists are the ones to provide the specific assessments, and therefore medical practitioners should take the lead to ensure patient safety rather than relying only on optometrists. But we are willing to work with peers in the healthcare sector on this to formulate a way forward. We are committed to protecting patient safety. Thank you. Professor Jason Yan from the Hong Kong Ophthalmological Society. We do appreciate optometrists providing health services to the public. We believe with close collaboration we can provide services that the citizens need. Ophthalmologists are able to provide professional screening services, while optometrists help with eye care of citizens. We have been working closely together to safeguard the eye health of citizens. We think any amendments to the Supplementary Medical Professions Ordinance should prioritize eye health of citizens. We need to consider the potential impact to patients. We also need to ensure that there is still safety with the amendments, that there should be an objective assessment mechanism as well as accountability mechanism in place to ensure patient safety. There should be more consultations to allow for discussion. So right now we do not accept that we should incorporate optometrist associations suggestions, but we are more than willing to collaborate with the optometrists and have further exchanges in future to see how we can better protect eye health with alternative solutions. Thank you. Dr. Chu Wei-Sing from the Hong Kong Chinese Medical Association. Western medical practitioners have been taking care of citizens for many years, and we have seen the healthcare sector would now involve not only registered medical practitioners but also other disciplines professionals in hospitals. They have an established mechanism, so we're not worried about the referral arrangements being made. But as other deputations said, for the healthcare sector in Hong Kong, we lack communication. I think the bill's provisions are a good starting point to facilitate communication, but I would say this. I have seen many allied health professionals, even if they are academically trained, they are trained to deal with the more serious conditions that they would see in hospitals. They actually do not have much experience serving the community. I think it is important to maintain communication. I think if there is an opportunity, since the government is promoting primary health care on a community level, regardless of which profession you are, we can all take part in this network so as to facilitate communication among different disciplines. When you draft the protocols, I hope that medical practitioners practicing primary health care can give their feedback. Thank you. Thank you, Mr. Chen Qinglong from the Hong Kong Physiotherapy Concern. I am student representative of physiotherapy. We welcome the bill to allow for more people to access physiotherapy services, but we want more of the restrictions removed. Right now in our clinical training, we actually have been trained to identify symptoms that would require referrals. Apart from listening to what patients say, we will have regard to objective facts, the age, the bone density assessments, and how many times the patients have fallen in the past year. We would make assessments. We have recently a patient falling off of a bed. While we have not received any instructions for the medical practitioner, we have provided assessments such as a lock-on test to rule out some of the risks. We have professional judgment to see if referrals have to be made. We have also been talking about this for many years. Physiotherapy students want the professional recognition. If you pose too many restrictions, in a way it is speaking against the professionalism of physiotherapists. We have reason to believe if there are unnecessary restrictions imposed, physiotherapy students may not want to practice physiotherapy, and there will be less people wanting to study physiotherapy. I urge the government to make changes if necessary. Thank you. Thank you. That's it for the deputations. And I will now ask the administration to provide a consolidated response. I'll assign a 10-minute time limit. I would first like to thank the many deputations who are here at this public hearing. When we consulted the stakeholders on the bill, we have had exchanges with the relevant stakeholders. We also welcome the student representative to have attended this meeting to provide his views. We have consulted 5 professions, the allied health professions, the Chinese medicine professions, etc. We have also got in touch with patient organizations. Many have made written submissions. We have already provided a written response to some of the written submissions. And for those we have not responded to, we will provide a written response in due course. As many deputations say, the bill has been in the works for quite some time. We are introducing amendments for a few reasons. First, we want to provide recognition to allied health professionals. So, as many deputations said, with the training and professional development standards of allied health professionals being quite high, it is now the right time for us to recognize the professionals better. We also want to facilitate interdisciplinary collaboration between Chinese medicine practitioners and allied health professionals and provide legal basis for that. We also want to facilitate professional development of allied health professionals. I would like to thank deputations for providing some very good suggestions for us to formulate our way forward. Regarding the views expressed by deputations, I would like to respond to several points on the waiving of referrals for physiotherapy and occupational therapy services. We have received feedback from multiple stakeholders to revise the term clinical protocols to clinical guidelines. We are currently studying the feedback. If necessary, we will introduce committee stage amendments on this. And deputations have also expressed concern about the scope of the clinical protocols. In the bill, we are not delineating the services by parts, actually. We are delineating them by conditions. In the first meeting of the Bills Committee, we actually said that the referencing authorities are now preparing the clinical protocols. In the first half of this year, we will have clinical protocols for the more common illnesses. We will consult the different professions on this to reach a consensus. For the first stage, we will have clinical protocols covering musculoskeletal conditions. These will not be limited to, say, parts, say, back pain or hand pain. With the developments in primary health care and accumulation of experience, we believe the scope can be expanded. We also have professional teams providing such clinical protocols, and while drafting of the protocols, stakeholders will be consulted. We also note some deputations say for occupational therapists. With the amendments of the bill, it would impede direct access to services of OTs. We actually provide one of the conditions that for physiotherapists, as long as there are emergencies and other circumstances as endorsed by the SMP Council, physiotherapists and occupational therapists can provide services directly. But this is just a legal framework. It does not pose restrictions to the services provided by PTs and OTs.
Regarding the referrals by the Chinese medicine practitioners, there are some views on this. By way of clarification in the bill, subject to the passage of the bill, then the allied professionals can take referrals from the CMPs. The council and the boards are have already started the communication regarding the code of practice or the conduct and expertise and so on. And we hope that there will be a consensus that will be reached. The administration has stated our expectation that 1 year after the passage of the bill, we would be able to announce the arrangements. We hope that we can take forward this in an orderly manner to more complicated situations. I'm grateful to the Academy of Medicine and the allied professions boards. Where necessary, we will be fostering the dialogues in this regard. Now, for the non-referral arrangement and also allied professions taking referrals from the CMPs, we heard a lot of comments in support of these amendments, and they hope that there would be a platform to follow up on the issues. Indeed, the Council of Allied Health Professions would be looking at the nitty-gritty about the implementation, and they will be consolidating the views of the boards, and where necessary, they will be coordinating all the stakeholders other than the 5 allied health professions. They will be coordinating the medical practitioners and other people in the hope that there would be a better coordination there. Where necessary, they will be consolidating the views for submission to the administration. The Health Bureau will continue to monitor the implementation and maintain communication with the Council. In terms of limited registration, I'd like to make some clarifications there. Like other medical professions, in terms of limited registration, this limited registration application is not really open up to anybody who would like to apply to come to Hong Kong. There are some prerequisites that the hospital authority and other public healthcare bodies must have issued them with an invitation. It's only because we are not able to fill the posts in Hong Kong that we would be inviting non-locally trained professionals. It's only with the invitation that they can make the application to the council for approval to make sure that they are up to scratch before they will be allowed in. For the public healthcare bodies, they would have to prioritize locally trained allied professionals. It's only when they are unable to fill the posts locally that they will open up the posts. we are not concerned about the scenario where there would be an oversupply of professionals, thus undermining the job opportunities for local people. Now, this limited registration, those registered will be serving for some time, and there is no question of them migrating to full registration. So they have to renew the registration if there is still a need for that particular person. And if they get the registration, they have to go through the application process before they get a registration. So in our manpower projection, there would not be any oversupply of talents. And every 3 years, we would be conducting the healthcare manpower projection, and we will keep an eye on the prevailing situation. We are aware that there are some allied professionals who would like to take advantage of this amendment exercise to deal with the definition, in particular the optometrists and also radiographers, that they have advanced their arguments there. Regarding the definition and scope of work, regarding the allied professionals, we keep our options open. We agree that we have to evolve with the times and revisit some of the issues. But all these amendments would have some implications on the division of work within healthcare professions. And we need to have a consensus, and we need to have the agreement of different professions. We do need to have dialogues and communication in order to achieve better coordination. And all these proposals fall outside of the scope of consultation. So we really wish to take forward these amendments, and we urge the Council and the boards of the relevant allied professions to engage in discussions regarding the scope of work and the definitions, and communicate with all the stakeholders before putting forward concrete proposals to the administration. We would keep an eye on all the necessary amendments to move on with the times. All right, throw the floor open for questions. Please press the button if you wish to speak. There are 5 members on the list, or 6 rather. Mr. Benson Look, Mr. Bill Tang, Ms. Chen Hui Yan, Ms. Judy Chan, and Ms. Connie Lam. We still have a bit of time, 4 minutes for each. Mr. Benson Look. Chairman, thank you. I've got 2 areas of concern. The first one is the referrals by the CMP, the Chinese medicine practitioners. Here in the proposal, this would be implemented in the Chinese medicine hospital, and in 1 year's time there will be a review for possible extension. We heard the views of the CMP representatives. Now, within 1 year, I don't think you would start the review after 1 year. Now, I saw you nodding, and I hope that there would be a real-time review, and in a year's time, you should be able to come up with some concrete proposal to communicate with the CMPs. I'm sure that they have been waiting for an awful long time for this to happen. Second, there is a view regarding the practicing hours snatched from 400 to 200 hours. I heard from the trade that they seem to be flabbergasted about by this reduction in the practicing hours. And this reduction in the practicing hours. Now, take dentists, for instance. We have increased the duration of the internship, and I hope that there would be some response to the biomedical scientists. In 2004, the MLT board has slashed the internship hours. Why is it the case? Yes, but thank you very much, Mr. Luke, for the opportunity to clarify the point about the referrals by the CMPs. Now, subject to this bill being passed, the boards of the airline health professions would need to make preparation. If they are ready with their code, they would be able to start with this. I know that the dialogues are going on at the moment, and this is being taken forward. So this 1 year period, by that we mean that within a year we should be able to come up with some announcements, or the nitty-gritty would be announced within this particular year. We are confident, and we know that things are moving ahead. Now, the MLTs expressed their concerns, and we also saw the statements over the years. We have been communicating with the council. Under the law, for these training hours and details, these fall within the professional autonomy, so there is nothing in the amendments in this regard. All along, we have been respecting the allied professions to engage in discussion and let the council handle this. We have been finding out about this from the council. I'm sure that they will be making a response real soon. Mr. Bill Tang, turn up the mic, please. You're not coming through. All right. Thank you, Chairman. And my thanks to all the 39 deputations and also the Health Bureau and the Hospital Authority representatives. Chairman, my views are straightforward, and this is a really valuable opportunity. And this copious bill, I'm sure that there will be a lot of opportunity for us to engage with the administration. So with your indulgence, Chairman, I'd like to put this to the deputations. And I don't think I would be able to fit in all the questions within such a short space of time. The first, for the physiotherapists, honestly, I've been communicating with the trade for some years regarding the direct access to PTs, that they do have their own standards and protocol, which will inspire confidence in the public and also other professions. Without a doubt, these amendments are moving us closer to this. Whether it is going far enough is quite another question. I'm not sure who can take this question. The government said or talked about your concerns, like the health conditions that would be used instead of certain parts of the anatomy, and there are certain wordings that would be changed. Are they going far enough? Second, how can you set the mind of other airline professions at ease? If you allowed more autonomy to serve the members of the public, you don't need to have referrals every time. How can you inspire confidence in the other airline professions and also insurance sectors? Would there be more stringent regulation in this regard? All right, who's going to answer this? If I may. Yes, please. I'm chairman of the association. Thank you very much, Mr. Tang, for the question. We are pleased that the administration has heard our views. The clinical protocols should be changed to guidelines, and also the issues regarding musculoskeletal issues. In this particular bill, my understanding is that that our association is in support of these amendments, and the primary healthcare authority, the HA, the DH, will be given the power when formulating the clinical protocols. We should have the best interest of the patients at heart, because after all, we are trying to facilitate the members of the public in receiving the services. Now, if this is the intention of the bill, but if we are putting in place a lot of hurdles for the public, it will not be good enough. So when formulating the clinical protocol, I hope that there would be more involvement from us.
市民安全呢？
How can we ensure patient safety? The government proposing amendments actually pose much limitation already, and there are safeguards in place with the bill's provisions. We have to follow protocols, for example. This is not seen in other parts of the world. The relevant board will update professional guidelines if necessary, I believe. I think we already have an adequate system to ensure patient safety. Thank you. Thank you. Next to speak, Ms. Chen Huoyan. Thank you, Chair. I would like to thank PTs, OTs, RGs, MLTs, registered medical practitioners, as well as CMPs coming here to express their views. I think there is much time for further communication, but please attach great importance to the views you have heard today. And you said you had general support, but then we heard from deputations earlier, they only support the bill in principle. They have actually many concerns about the operational details. I urge the administration to make amendments if necessary, especially for the providing of direct access to PT and OT services. I actually want to ask a professor, and maybe Mr. Chen Qing-Long of the Hong Kong Physiotherapy Concern. We have seen before in other places, Hong Kong practitioners can actually provide services directly without referrals. And if Hong Kong is doing with its current practice, will it delay treatment for patients? I also want to ask Mr. Chen Qing-Long, we have with non-referral arrangements elsewhere, we may lose Hong Kong graduates to elsewhere. So I want to ask, as a young student yourself, if you know that there are restrictions imposed on physiotherapists, will you still work in Hong Kong? I also want to ask another professor of Chinese medicine. I want to ask if we have the administration continue with its approach, will it hurt the Chinese medicine practitioners? Thank you. We will first have the Professor Aaron Leung speak. Thank you. In Australia, physiotherapists can be first contact practitioners. Unfortunately, in Hong Kong, that is not the case. Referrals would be required. According to literature and my experience in Australia, as well as studies in other advanced economies, whether it will increase risks with non-referral arrangements, it has not been the case. So it would not increase the risks if we allowed PTs and OTs to provide direct services. All right, thank you, Mr. Chan Cheng Long. Anything to say? Well, I would say this. As said, we have more students in Hong Kong, but we have not seen the number of places for work increase. We have I heard there is a program in Australia that would not require any conversion. I think if they would allow students to work there, I think students would be inclined to work in Australia and other places. Professor Wong Kit, if we are to allow CMPs only in the Chinese medicine hospital to make referrals, well, I myself am a traumatic Chinese medical practitioner. Every day we would see at least 3 patients that would require diagnostic imaging. We do not have the referral rights. I would say there are detriments to patients, so I urge to either not have the power vested in CMPs in Chinese medicine hospital altogether, or have that power vested in all CMPs. I actually recently had a case. I note that a patient recently got diagnostics on their condition being compressive fracture. If Chinese medicine practitioners are not aware of this condition, it can pose some risks. That's it from me. Thank you. Any response from the administration? None? Ms. Judy Chan. I would like to thank deputations for expressing their views today. It is a valuable opportunity for us to learn of your views. I know that many deputations support the bill in principle, and many of you are speaking from the perspective of patients. I really appreciate that. I would also like to ask deputations some questions to give more time for them to speak. I note that some very detailed submissions are received. I also want to ask the Hong Kong Physiotherapists Union, can you elaborate on what you said in your submission about the figures? And you essentially gave a counter offer to the administration. I want to ask if the administration has gauged the different approaches adopted. That is, instead of adopting a diagnosis given in the past 12 months, or the number of days or number of times that one has experienced certain things. Who is going to answer this question? Mr. Ao Yang Kin, right? From the Hong Kong Physiotherapists Union. Thank you. We have 72% of the world's countries providing limited or direct access to services. We have actually conducted a study to see how there can be direct access to services in Hong Kong. We have referred to the practices in other places, and we note that in many places they would pose the conditions in the form of a number of times or a number of days. And if one has gone to physiotherapy over 10 times and after 30 days, referral should be made back to registered medical practitioners. So that's it from me. Administration, any response? Right, I will be brief, and then I will ask Dr. Pang, Commissioner for Primary Healthcare, to talk about the plans for a primary healthcare network. I would first like to thank the deputations for providing their views. We have consulted them early on, and in the bill there are 3 pathways. 1, patients can produce proof of diagnosis from a registered medical practitioner or registered CMP within the last 12 months. So that would not have any reference to the symptoms or conditions. We would also have another pathway, compliance with clinical protocol promulgated by referencing authorities or cross-disciplinary collaboration arrangement of the Primary Healthcare Commission. That also does not have any reference to the conditions. We have been discussing extensively the 3rd pathway, what happens clinically, emergencies and other circumstances. As I said earlier, this will not be based on thoughts. So I would say this, with this framework, I think we can try to accumulate experience upon implementation first. I think also with cross-disciplinary consensus, we may expand the scope. I'll now let Dr. Pang speak if the chairman would allow it. I would like to thank the deputations for their comments. I understand that the physiotherapist profession would need some criteria for making referrals, compulsory referrals. But I think we need to have extensive discussions about what the criteria should be in the first place. But I would say this, in different places, they have different practices. Say, in Australia, their referral arrangements, they have a more mature GP system. There can be convenient communication between different disciplines. It is only with that we can achieve good results. I think right now, with reference to local circumstances, the approach we propose would be more appropriate because we need to consult registered medical practitioners whether the number of times will make it risky. Whether 10 times would be prudent enough, or is it the case that for some conditions, the first time that patient exhibits certain symptoms would already require referrals to be made. Sometimes it may be more than 10 times and referrals still do not need to be made. I think we should be prudent when drawing up the relevant criteria, and it is only after extensive discussions among different disciplines that we can do that. Thank you. We have approximately 15 minutes left. We have 3 members who are about to speak. I will be prudent and extend the meeting in advance by 10 minutes. If members have no objections, all right, thank you. Ms. Lam So Wai. I would like to thank the deputations for coming here today to express their views. Before, the administration said for the allied health professions, they had consulted the professions 60 times, but we seem to get some more information from deputations today. So I again welcome deputations for coming here today. I want to actually ask the optometrists. I know that, for example, Professor George Wu talked about how after years of experience there is a need to revise the definition of optometrists, and there is an additional part 5 and 6. There are some concerns conveyed. In the end, we want to have the best interests of patients in mind. I think we need to maximize collaboration between the different disciplines while maintaining the standards of different disciplines. I would like to ask Professor George Wu, your hair is even gray now. What have you been doing in advocacy? Can you share with us your experience? Thank you. Mr. George Wu.
Please turn up the mic. Number 15, turn up the mic, please. Thank you for the opportunity to address Ms. Lam's question. I have been working very hard for the development of optometry in Hong Kong. I've been professors in North America in 2 universities for 3 years, University of Waterloo and Indiana University for 4 years. We have graduates all over Canada. Optometrists in Canada are on the same par as dentists and doctors. Now, this is very simple, very straightforward. That this is something that is going on. We're not talking about the scope of practice. In 2008, when the government came up with the definition, this has been watered down. We'd like to increase the scope of practice, but this has been watered down. This has been going on. In the PolyU, we deal with primary health care, eye health. Refraction is only part of the course. But basically, we're dealing with eye health and eye care. The graduates must be competent in these areas when they graduate. And they are doing this in the community. So I am none the wiser why there is consultation after consultation. They started in 2008. And the health panel had discussion in 2013. The scope of practice after dentists, doctors, and CMPs, 80%, 90% of the work has been done, but all of a sudden, the primary health working group, Dr. Ko Wing Man, cut this short. This was brought to a halt. At different times, there was consultation, and we have been seeking audience with the administration to finish all that which has been not been finished, but we failed to accomplish anything at all. Chairman, finally, I don't think we'll live to see this happen in Hong Kong, but I am pessimistic about the development of optometry in Hong Kong. Thank you, Professor. Professor Chen Ming-Kwong. Chairman, thank you. I thank all the deputations and all the organizations and individuals that submitted their views. First, I'm sure that we are aware that we are concerned about the timetable for the CMP's referral to the MLTs and RGs. The government said that within 1 year after the passage of the bill, there would be a consensus that would be reached, an announcement will be made, and then there would be orderly and timely extension to more complex areas. As to how we can take this forward in orderly manner, there is very little information. So my question for the administration is, would there be clear-cut time frame and a roadmap, and the government will make sure that they have some skin in the game to foster effective communication and discussion to implement referrals as soon as possible. And also, in some of these submissions, they express that with this referral by CMPs, that would affect the role of medical practitioners. I think that these kind of worries and concerns are unfounded because CMPs don't have any intention to usurp the role of the Western medical practitioners. The idea is to foster better collaboration between the professions. This is only good for the patients. So I hope that the administration will explain to us again to allow the allied professions to take referrals from the CPMs. We're not trying to allow the CMPs to usurp the role of the medical practitioners. Will you be assuaging these kind of concerns? I defer to Dr. Zhong. Dr. Zhong, thank you very much for the comments. With the amendments, the Chinese medicine panel will be reviewing the code of practice, and we are liaising with the other allied professions to amend the codes to allow the referrals to happen in orderly manner. And there are different examination would be different in their nature. And we have to make sure that all these lab tests will be conducted in an orderly manner. The Chinese Medicine Hospital is the flagship organization. It has the clinical setting, which is different from other practitioners, and they also have the clinical governance body. It is playing the role of transforming the trade to upgrade the clinical capability. They will be consolidating their experience, and they will be collaborating with the boards of different allied professions to make sure that the implementation will be done in an orderly manner, to make sure that they will happen in a smooth manner. And the development fund will also support different professions and to have more communication and dialogues and more training to make sure that the allied health professions can enhance their abilities. Thank you. Mr. Bill Tang, how long do I get? 4 minutes. Thank you, Chairman. We heard from the deputations, their submissions, and I hope that the administration will elaborate on this one. The OT Association, Ms. Fong, said that they are providing services to the underprivileged and there is no need for referrals. And they are concerned about this being jeopardized with the passage of this bill. Now, we are talking about OT. Now, we have Hip Hong Society here. Will what you said also be applicable to physiotherapists as well? Second, the radiographers talked about the internship hours, or the MLT talked about the MLT hours. They slashed the training hours from 400 to 200, and the government said that this is professional autonomy. I am puzzled as to why this is happening like this. Will the administration address this, and then we'll allow the MLTs to explain this? DS. Right, first of all, about the physiotherapists in emergency situation, we understand that the council is also allowing the physiotherapists to provide services in emergency situation. In the bill, we would incorporate this, but the council will need to spell this out in the code. That's in answer to the first part of the question. Regarding the medical laboratory technologies, as I said a moment ago, we have taken note of their statement, and we're asking the relevant board to make a response. We will not be dictating this, but we are making sure that the board or the council would be playing a role in relation to the training. They will be coordinating the views in the trade. We would be asking them to make the response as soon as possible, and we will keep this in view. Mr. Tang? Will the Association for the MLT be making any comments? Let me see. There's the Biomedical Scientists Association. Thank you very much, Chairman. Every allied health professions have their own mechanism to determine the clinical training hours. For the sake of the patient's safety and for the sake of the health of the patients, I think the government should step in and understand more as to how a good balance can be struck, and there should be guidelines to be given to the allied professionals to come up with a good mechanism which will not compromise the rights and interests of the patients. Administration? No? Thank you very much. Everyone who intends to speak has already spoken. Date of next meeting, 21st of May, Wednesday at 8:30 a.m. Please attend the meeting accordingly to make sure that we have the quorum for the meeting. Unless members have any further comments, meeting is now adjourned. Thank you very much all the deputations for being with us. You may wish to leave your submissions or your speaking notes behind. Please write down the organizations you represent. Meeting is adjourned. Thank you very much.